Good afternoon, and thank you for joining us. Before we dive into our call to action, allow me to introduce the team behind today's presentation. We are four passionate voices with one sheer goal: to drive meaningful change through informed health policy. Team member Erica Bajad, Courtney Middleton, Jamie Parnell, and myself, Natasha Johnson. Together we bring diverse perspective, shared determination, and a united vision for improving health outcomes. Think of us as your policy pit crew, each of us bringing a unique tool to the table, all working towards the same finish line: actionable, impactful reform. Inadequate nurse staffing has emerged as a critical health policy issue, significantly impacting patient safety, the quality of care, and the well-being of nurses across the United States. Nurses are the backbone of the healthcare system, yet many are stretched thin, managing unsafe patient loads that jeopardize their safety as well as their patients. The healthcare industry must prioritize safe staffing as a key aspect of quality improvement and workforce stability. The proposed legislation, S1113, the Nurse Staffing Standards for Hospital Patient Safety and Quality Care Act, offers a solution by mandating minimum nurse-to-patient ratio in hospitals. This policy aims to reduce nurse burnout, improve patient outcomes, and standardize staffing practices across the healthcare setting. The issue of inadequate nurse staffing affects a wide range of stockholders. Patients face a higher risk of medical errors, hospital-acquired infections, more extended hospital stays, and even death when there is not enough nurses to provide timely and effective care. Nurses experience chronic stress, emotional exhaustion, and burnout, which leads to decreased job satisfaction and increased turnover rates. The broader healthcare system also suffers from the consequences of understaffing, such as higher operational costs, lower patient satisfaction scores, and increased readmission rates. Vulnerable populations, including the elderly, chronically ill, and underserved communities, are disproportionately affected due to their greater reliance on consistent and quality nursing care. Research strongly supports the relationship between safe staffing levels and improved health outcomes. A widely cited study published in The Lancet found that each additional patient per nurse was associated with a 7% increase in the likelihood of dying within 30 days of admission and a 7% increase in the odds of failure to rescue. Each additional patient per nurse was linked to a 23% increase in the odds of nurse burnout and a 15% increase in the odds of nurse job dissatisfaction. Furthermore, evidence from a new study from the University of Pennsylvania reveals that nurses working under safe staffing conditions reports 20% less burnout and significantly higher job satisfaction. High workloads contribute to nurse burnout, leading to higher turnovers. According to American Nurse Association, nearly 18% of new graduate nurses leave the profession within their first year, citing stressful working conditions and understaffed environments. The association also found that 69% of nurses experience some form of burnout. Adequate staffing improves job satisfaction and retention. The Journal of Nursing Administration also confirms again that hospitals with inadequate staffing has higher rates of hospital-acquired infections and other preventable complications. Lower nurse-to-patient ratio are linked to fewer hospital-acquired infections such as UTIs and pneumonia. California, the only U.S. state with legislated nurse-to-patient ratios, is a successful model reporting improved patient outcomes, reduced nurse turnovers, and a greater workforce stable since the policy was implemented in 2004. Here, this graph displays research from the Journal of American Medical Association showing that hospitals with better nurse staffing have significantly lower mortality rates and fewer adverse events. Studies spanning 2 decades consistently demonstrates that adequate nurse staffing directly correlates with improved patient outcomes. California, which implemented similar legislation in 2004, has reported a 14% decrease in patient mortality in medical surgical units compared to matched hospitals in other states without mandated ratios.
The Nurse Staffing Standards for Hospital Patient Safety and Quality Care Act establishes minimum RN to patient ratios across various hospital units to improve patient safety and care quality. It mandates that hospitals submit staffing plans to the Department of Health and Human Services, post ratios in each unit, and maintain shift records to ensure adequate staffing levels. The Act also prohibits mandatory overtime to solve staffing shortages, ensuring that nurses are not overburdened and that patient care does not suffer due to understaffing. The Act provides strong whistleblower protection for nurses, allowing them to refuse assignments that would violate staffing ratios or exceed their level of training without fear of retaliation. Furthermore, the Act invests in the nursing workforce by expanding funding for loan repayment, scholarships, and retention programs. This includes preceptorships and mentorships to support professional growth and career development. Our proposed policy change consists of amending the current policy to include the following provisions. First, we would like to mandate the presence of at least one patient care technician on all inpatient units during every shift, with a recommended minimum ratio of 1 PCT for every 8 patients. In addition to requiring at least one dedicated unit secretary per hospital unit per shift to manage incoming phone calls, facilitate communication, and handle admin duties. This ensures nurses can remain focused on direct patient care. We would then also establish a National Nurse Staffing and Workforce Development Council tasked with overseeing strategic nursing workforce planning at the federal level. This council will track staffing trends, identify shortage areas, support nurse education pipelines, and provide ongoing guidance for sustainable workforce development. So why is this policy change important? In today's healthcare settings, nurses are increasingly burdened with non-clinical responsibilities, significantly reducing the time they can dedicate to direct patient care. Burnout and turnover rates among nurses are climbing, directly disrupting the quality and continuity of patient care. At the same time, chronic understaffing in many facilities leads to missed care and a higher incidence of medical errors, further jeopardizing patient safety. To address these challenges, hospitals must better utilize support staff so nurses can apply their unique training to focus on clinical tasks. This approach not only enhances efficiency, but also helps to retain nursing talent. With the national nursing shortage continuing to deepen, it is vital to begin strategic, large-scale policy planning to ensure a sustainable and effective healthcare workforce for the future. Policy alternatives and outcomes. If we do nothing, nurses will continue to be overloaded with non-nursing tasks. This will continue to lead to burnout, missed care, and lower patient satisfaction. We could implement an alternative by encouraging hospitals to independently hire PCTs or secretaries to create their workforce strategies. The outcome will most likely be staffing support will vary widely across hospitals. Some hospitals may add support staff, while others may not, leading to inconsistent staffing levels. By executing the policy change we support, the outcome will result in having consistent support staff. That's 1 PCT for every 8 patients and 1 unit secretary per staff. This allows nurses to focus on their most important tasks and provide safe, high-quality care. The National Nurse Staffing and Workforce Development Council will help plan for the future, address areas with nursing shortages, and support the growth of the nursing profession, leading to a safer, more efficient healthcare system.
The advantages of this policy include substantial reductions in nurse burnout, improved staff retention, enhanced patient safety, and greater consistency in care delivery nationwide. By allowing nurses to focus on clinical tasks rather than administrative or non-nursing duties, the quality of care improves and the risks of medical errors decreases. Additionally, National oversight through the proposed council would help build a more future-ready workforce, support nursing education, and proactively address regional shortages. However, the policy change does come with some disadvantages. Requiring defined nurse-to-patient or staff ratios can lead to various drawbacks. The primary concern is the financial burden of hiring additional staff, particularly in hospitals already facing budgetary constraints. Administrators hesitant to adopt federally mandated staffing models may also resist. Moreover, in some areas, finding qualified patient care techs or secretaries to meet the required ratios could be challenging in the short term due to workforce limitations. In the short term, implementing this policy will require financial investment for hiring, training, and administrative infrastructure to support the new council. However, long-term savings are likely as studies have shown that safe staffing levels are associated with lower turnover, fewer adverse events, and reduced hospital-acquired conditions, all of which decrease overall healthcare costs. From a feasibility standpoint, aligning this policy with current CMS quality initiatives and offering implementation grants or phased rollouts could help ease the transition and increase support from healthcare institutions.
During the process of evaluation, several key factors, risks, and indicators of the change should be evaluated for positive or negative change. Metrics can be assessed, evaluated, and continuously revised for signs of improvement to promote an optimal and efficient process. Once the changes are evaluated, adjustments can be made to encourage increased productivity. Key factors to monitor for changes include monitoring nurse satisfaction and turnover. Nurse turnover rates should be monitored for rising trends. Formal and informal meetings should be conducted between staff, or among staff rather, just to assess their perspective and see how the policy change is working out on regular intervals. Patient satisfaction and safety. Less inpatient falls should occur. Most inpatient falls occur unwitnessed, and more staffing would mean a decrease in falls since there would be more staff that are available to respond to call bells and be able to round on the patients to ensure their safety. With patient surveys, there should be a better rating as far as their stay while inpatient, because there would be more staff that could take care of them and respond to the call bells, so there would be an increase in their patient survey rating, which is a positive thing and reflects directly on things such as magnet designations and the reimbursement that the hospital would receive. Several nursing organizations, including the American Nursing Association, National Nurses United, and Nurses in Clinical Settings, support safer staffing and would be very approving of appropriate nursing patient ratios. However, some supporters don't have a vested interest in safer staffing and would require more evidence to the risk versus reward ratios for better staffing standards. Educating and informing those that are unsupportive of the policy would definitely benefit the policy change and would be able to shed light to those that are unsupportive that there is a benefit to better staffed units. The biggest barrier would be, of course, hospital CEOs and administrators who may see the increased staff as a greater risk, or a greater cost, rather. But this can be countered with reduced rates of infection and reduced adverse events. Legislators, they would also be a barrier, but they would just have to be educated on the risks associated with poor staffing and would likely come on board with this idea. Providers, as far as advanced practice nurses, they would probably be very well aware of the dangers of poor staffing. But our other advanced practice providers, such as PAs, and of course the physicians, would also have to be brought on board and would likely be well accommodating to the idea of better staffing when they realized that it would provide a safer environment for the patients. In summary, amending the policy to include standardized staffing for PCTs and unit secretaries, and to also include a National Nurse Staffing and Workforce Development Council is beneficial pretty much all around. It would decrease nurse burden, reduce burnout. It would also just provide a safer area for us to take care of our patients. But it all requires us to take action.